today is actually co-hosted by the Center for Innovation and Global Health and the Center for Human and Planetary Health here at Stanford. So we're going to get a worldwide One Health, human and global health perspective today on this panel. So we have on our panel Jalema Aluvala, who is coming to us from Kenya University of Nairobi and Kenyatta National Hospital. He's a pediatrician and child health consultant. Welcome. We have Valeria Ramirez Castaneda, who is a King postdoctoral scholar here in the School of Medicine at Stanford. We have Amanda Mar-Chung, who is the executive director of the Center for Innovation and Global Health. And then online, we have two special panelists. We have Caroline Ferguson Orlando, and let's see, maybe I can do something fancy here so they can turn their video on for a second and wave. So Caroline is a marine social scientist at the Stanford Doerr School of Sustainability. And then finally, we have Camille Jimenez, who is the Global Patient Equity Research Lead at Pfizer. So welcome to everyone. Okay. Great. So I just wanted to start just by briefly introducing myself so you know my perspective and where I come from. So I did all my training, my pediatrics, infectious disease, got my master's in clinical epidemiology in the Midwest at Rainbow Babies and Children's Hospital, and made a lot of partnerships there that I then carried with me to California in 2009 when I went to the Children's Hospital of Oakland. And then I spent 5 years there carrying relationships and people with me to come to Stanford then in 2014. So I've been at Stanford for 11 years now. And I've worked in many, many parts of the world, but since the very beginning, I've been working in Kenya. So a lot of my partnership experience comes from those relationships. I've been in Kenya for more than 20 years. And my partnerships have evolved. I come as an academic, but now I also co-lead a nonprofit in Kenya with a long-term research collaborator. And so today we're here to talk about equitable global partnerships. And inherent in that, and it's really at the base of all of that, is the fact that we all believe that there is incredible value in every single partner in a partnership. And the goal for the work and the partnerships and for our lives is actually to live out that value in each one of us. And we have some very wicked problems right now in the world, right? Very colossal, huge global challenges. And what it's going to take to solve all these challenges is us coming together in really optimal partnership to share everything we can to work together to come up with those solutions for the challenges that we face. And probably everyone in the room knows about the Sustainable Development Goals. These are the goals to keep a healthy planet, and humanity is really a part of this. You know, it really shows us the interconnectedness of human life with all other life on the planet. And at the center of the SDGs is number 17, which you can't see because this is here. Hold on, but it's actually partnerships for the goals. So partnerships at the very center of everything. One of my partnerships, I worked in Ecuador for some time with an incredible climate scientist and epidemiologist named Ana Ibarra, which is right here. She's right here. And so for about 5 years, we worked together and co-edited a book on transforming global health partnerships. And this book took us 5 years to create. It is a compilation of the lived experience, expertise, and meanderings of more than 90 authors from 26 countries of the world. And there's actually a flyer somewhere on the back with the QR code because the book is free and available for all to read. The way that this book is structured is a little bit how we're going to structure our panel today. It starts with foundations and then moves on to the learnings, the case studies from these 90 authors. And then it goes to the dreaming of a future, more equitable, more optimal vision for the world through equitable partnership. And this is the first figure in the book. And this is the most disturbing figure in the book. And what this is it's the map of the world in 1910. So this is about 100 years ago, a little bit more than 100 years. And what it's depicting is it's showing the British Empire and the fact that Britain controls 81% of the world. Wow, right? I mean, so we are going to start today with the foundation and just a little bit about colonialism and its impact on the world. So you can't talk about equity and partnership unless you address colonialism and the fact that really reducing disparity in partnerships requiring acknowledging that all of global health is actually founded on colonial ideology. And partners across different geographic landscapes and boundaries, across different socioeconomic circumstances can knowingly and unknowingly kind of perpetuate these ideologies, these negative ideologies that we've all kind of just been steeped in. It's the soup we've been steeped in over the years. And so our work is really to actively work to decolonize global health practice. And the reason why we do it is because, again, every person has inherent worth and dignity and a lot to bring to the partnership. And not only our lives and our partnerships, but the world and the solutions we come up with are going to be better when we do this work. And we all sit in positions of power and privilege, and a lot of times unknowingly and knowingly we perpetuate things, right? And so it's really important to know yourself and to know your positionality so that we can, can you do that? Yeah. Okay. I would keep it at the top. Okay. Okay. Go. To know your positionality as you enter these partnerships, right? In order to be the best external partner, it's important to be the best internal partner and actually know where you sit, what your position is and what your positionality. So I just wanted to share a few key tenets from the book to sort of kick us off. And then we are going to move towards each one of our panelists giving a few comments of their own so you understand their perspective and their partnerships. And then we'll move to some time where I have some questions, and then we're going to open it up for the audience to ask any questions you have. So again, these are the key tenets from these 90 authors. So acknowledging colonialism and inequity, centering trust in our relationships and our partnerships, staying open and humble to learn, and really taking the time to learn about the history of the place you're working and the history of the land, the history of the people. Embracing our diverse roles. You know, I said academic partnerships, but a lot of us have many different roles, and that really becomes very important in our partnerships. Expanding the boundaries of what we think of as legitimate science becomes very important to balancing power dynamics and knowledge. Repairing our interconnectedness with our planet. Working within imperfect systems to drive change, and we will spend a lot of time today on that because we are all working in imperfect systems that need to change in order to make partnership more equitable. We're going to talk a little bit about transforming funding schemes in education as well, disrupting the status quo, bringing our whole selves in service to the partnership, persisting in hopefulness, and then experiencing the joy and power of human connection. And so I just want to leave people with this because joy really is the engine that really keeps this work going. There's a beautiful newsletter that was published yesterday from Jamie at the Center for Innovation and Global Health, all about global health and joy. You know, right now is a really tough time for global health, but it's the joy and the relationships and the partnerships and the human connection that really keep us all going and keep our work going. And it's vital to this work. And then for all the students out there, because this panel was actually a brainchild of the students, so I hope there are lots of students here. But I'm going to be teaching a class on equitable global partnerships and health and beyond in the spring on Wednesday. So if you're interested in that, please come talk to me. So let me call up our very first panelist for a little introduction to Jalema. Thank you.
Thanks very much, Desiree, and it's a great pleasure to be here today to share my story. So my name is Jalemba Lovala, as introduced. So I'm a pediatrician and epidemiologist from Nairobi, Kenya. I've served 3 roles as a physician and a scientist and an educator in 3 institutions. That's principally the University of Nairobi School of Medicine, where I'm faculty member in the Department of Pediatrics. I provide clinical service at the Kenyatta National Hospital, which is our national teaching and referral hospital affiliated to our medical school, and done my research work principally with the Kemri Wellcome Trust Research Program. The third partner in that program is Oxford University, which I'll come to in a bit. So in those roles, formally, I'm a senior lecturer in the university. I'm a consultant pediatrician and also a research scientist in epidemiology and health services. My area of interest is in neonatal health, especially specifically looking at outcomes of neonates who are admitted to our hospitals, determinants of those outcomes, and how to improve those outcomes in various ways of interventions. So since I'm an epidemiologist, I'm used to numbers and figures, but I thought just before I get into that, in the context of what Desiree just said, a quick story of my background. So in this, talking about the British colonialists, colonial history for Kenya. So I think my family is interesting in the sense that my great-grandparents were born before Kenya existed. Mm-hmm. My grandparents were born before colonial times, and they were the first colonial subjects. My parents were born as British subjects. and I was born as post-colonial times in Kenya. Fun fact about my mom, she was born in 1952 when Queen Elizabeth became queen in Kenya when she visited at age of 18. And as British subjects in primary school, she still can sing actually God Save the Queen, which is very anachronistic, but very, very fascinating. Yeah? Another quick one about Ubuntu. So my community, we have a large language group called Bantus, and a quick lesson on Swahili. Anyone, I know besides Miriam, anyone else who speaks Swahili? Oh, kidogo, excellent. So in Swahili, the word for person is mtu, MTU. The word for people is watu, WATU. And the word for humanity is utu. So that Ubuntu is a variation of Bantu words, which is very similar to utu. So coming to the more technical side of things, this just illustrates, not getting into the scientific detail, my journey as a scientist, and what I wanted to illustrate there is two things which I think are huge milestones for everyone who has done lots of been involved in research. The first paper on your left, that's on your left, yes. You can see I'm the first author there, so that was my first author paper in 2014. And the paper on your right is about, that's how many years later? From 8 years later is my last author paper. And in the spirit of what we are discussing today about equitable partnerships, I think one person who has been very vital and illustrates the kind of relationship I think is very productive is a gentleman known as Professor Mike English, who you can see as the last author in 2018. But in 2022 is in there, but is no longer the last author. So I've worked with him as first author, and I've had the opportunity to finally be a last author with him somewhere there in the middle. So quickly looking at the examples of the partnerships I've had over the years as a research scientist, obviously starting off with the SASH program, and within Europe with the University of Oxford, also Rush University here in the States, and other partnerships in the UK, there's University of Nottingham and the London School of Hygiene and Tropical Medicine, locally in Kenya, regionally with the Makerere University, and then across the world with different people with the WHO. As a medical educator, so I've had occasion to teach on a program which called EAT Plus Emergency Pediatrics within East Africa, and we now have an asset collegiate system of training, and within in pediatrics is the College of Pediatrics and Child Health, which covers East, Central, and Southern Africa, and have had occasion to be a supervisor, also a student advisor and mentor for students at the University of Oxford and University of Washington. I'll finish off with I think a big lesson for me in the work that I've done is we tend to look outside when we are thinking about partnerships and collaborations, but those don't work without having a firm partnership locally. And here we have a large group of people. So I work within a clinical network, which at its peak we had 24 hospitals with the neonatal units of 24 hospitals. And these are just some of the representatives of the team members from those hospitals whom we have worked with from 2014 right up to now, which is we just celebrated our 10 years anniversary last year. And within the network, with the efforts that these people have led, we now have a database, a routine database, which includes more than 250,000 neonatal observations, which would be hard place to find. So I think this is the biggest part and the biggest foundation of any collaboration, the starting off locally before you go outside. Thank you very much.
Okay, I'm next. I don't know if I just, okay, yeah. So hi, my name is Valeria Ramirez, and I'm going to talk a little bit about my work. So my partnership experiences, and this is me in the Colombian Amazon, and everything is around the Colombian Amazon, what I have done until now. And I'm a Colombian biologist. I have been working as a biologist since the undergrad, and I have been working everywhere in Colombia mostly. I actually haven't done any work outside Colombia. And as you can see, biology and of course everything that is derived is very collaborative. We need a lot of people to be there and help us. But right now, I'm also one of the thousands of international students in the US. I'm doing a postdoc here and I did my PhD here. And I'm also part of the Latino community here in the US. And I was just reflecting, why could I come to the US in comparison with my colleagues from the university in Colombia? And one of the things, there's a lot of possibilities, but one of the things that are around and I have been exploring a lot is access to English education, access to English language. And that means like access to money to pay for English classes or to live in a city. For example, I come from a city and things like that. And that makes a difference if you want to apply for a master or for a PhD position. Of course, there's a lot of thousand things, but this is one of the ones that I have been exploring more. And because I'm from the biggest city in Colombia, from the center, and I work in the Amazon, this also creates a power dynamic inside the country. So the Amazon, this is a map of like multi-variable poverty, so it's calculated with a lot of variables. And Bogota, that is in the center, the biggest city, has the lowest one in comparison from other places in Colombia, and the Amazon has a higher like poverty number. And that means that I'm also under a power dynamic, but I also could replicate power dynamics where I work. And again, I work here, where this is the star where I work, in the middle of the Amazon, where local and indigenous communities live, and researchers too. And this local means like also me, like they call it colonos. So it's the people that come from the cities and go to the Amazon. So it's kind of also an idea of colonization too. And I have been working there for more than 10 years. I worked mostly with the snakes, but right now we are actually asking how these Amazonian cities are growing. And that's kind of the job that I'm doing right now. And I was thinking like, why to think about partnerships is important. And as the series said, well, academic research has been tied to colonial and capitalist activities that have shaped these power asymmetries that we see right now. There's no other way to think about this if we don't want climate change to continue, if we don't want, like, we have to reshape these power dynamics. And that's why, as a partnership for me, I'm kind of in the middle of the sandwich. You know, I come from a city in Colombia, but I work in the Amazon, and here I'm a Colombian, a Latino in the United States, and you know what that means more now. So I'm kind of in the sandwich of the power asymmetries. And this is very, you can see it like everywhere. This is just publications about biodiversity. You can see where biodiversity is in the world and where the publications and first authors come from. Is not even correlated a little bit. So I just want to think a little bit about what a collaboration is. And of course, a collaboration is a two-sided thing. Two partners have to be there. But that doesn't mean, even if both get mutual benefits, that doesn't mean that these benefits are not under a power dynamic. So what I'm trying to say is equal benefits are not the same as mutual benefits. Like, I can get a benefit, someone else can get a benefit, but that doesn't mean that it's equal or it's fair. So I think in a long term, what we're trying to think about is how to make this fair. Not only neutral, not only like you're getting something, I'm getting something, but when is it fair for both positions? And yeah, I think that's all. Thank you.
Larry has also written some publications related to equitable partnerships, and they're really fabulous. So
And they're on our website.
yes, and so I encourage you to check them out. So first of all, my name is Amanda Mar-Chung. I'm the Executive Director for the Center for Innovation and Global Health, and I'm so honored to be a part of this panel. I kept refusing, but Desiree insisted. So just to give you a little bit of background about myself, I've been working in global health for over 20 years in HIV, malaria, maternal child health, and eye health. in Latin America, Asia, as well as Africa. I actually started my public health career at a federally qualified health center in San Francisco's Chinatown. I've worked in the health departments in Seattle and San Francisco, but most of my career I've spent in academia. So first at the University of Washington, then 10 years at UCSF, and now here at Stanford. And one other detail I'll share with you is just that I decided to go back to school 5 years ago and completed my doctorate in public health at UC Berkeley just 2 years ago. And so that also coincided with me starting my job here at Stanford. So it was a bit of a crazy time, but as I was trying to ramp up in my new role. So all of this is kind of relevant to what I'm going to be sharing next. So while I was at UCSF, my collaborators and I developed this framework for strengthening leadership and management capacity among frontline health workers. And it's been used now by malaria programs in Eswatini, Zimbabwe, and in Namibia, as well as in the HIV program in Zimbabwe. And now it's being rolled out in Cameroon and Cote d'Ivoire. And really at its core is this kind of cyclical and iterative nature to the work. And so it's really trying to prioritize local challenges and then involve local stakeholders in the co-design of solutions to resolve those challenges. So it incorporates both quality improvement and participatory action research. And so we start every project basically with an initial workshop, which is pictured up at the top. And that's where we really try to recreate the system in the room. So we're trying to get stakeholders from all different levels of the health program into one room. So the community, the district, the provincial representatives, as well as the national, to all talk to each other and work together because they don't often have the opportunity to do that. And so this is just a photo here of one of the exercises that we do called friendly consulting. And so every participant gets the opportunity to not just draw, but also describe what their challenges are in the health program that they encounter. And then the 4 other people in their group get to serve as sort of the peer consultants to sort of advise them on how should they tackle their challenges. So, but by the end of this initial workshop, what we get is a much better understanding among every single participant about what the role is that each person in the room plays in the health system. We also get a work plan that is basically kind of prioritized and agreed upon by the entire system, that then a group of people who are representing different disciplines as well as different levels in the system, they are taking forward and they're choosing metrics to measure progress over time. And the other thing that we really want to do is ensure sustainability to the work. So we also have like a local training capacity strengthening piece to it, where we're really trying to train local facilitators in our work so that this work can carry on even after our support has been withdrawn. So this is a photo of a workshop that we did where we were sharing draft personas that we developed based on some qualitative research that we did. And so the personas were really meant to kind of summarize what various stakeholders across the health program felt about the male circumcision program and how to foster, greater ownership over the program, because the whole goal of the work that we were doing was to try to transition this vertical health program that was kind of running parallel to the health system and integrate it so that it was more, instead of donor and partner led, it was government owned and operated. So this workshop here, we're sharing kind of these draft personas that we developed, and then we really just wanted to get feedback from the participants on where we needed to change things or what was missing. And then one of the easy fixes was just around like that they wanted to see local Zimbabweans as part of the personas. So I got a number of participants to just agree to be models. So this is a picture of Lewis, who then gladly agreed to be the village chief persona. This is one of my favorite photos here, and it's showing my research team and me. And this photo was taken actually 2 years after our project to support the Ministry of Health in Zimbabwe started. And so unfortunately, kind of the timing of this was such that it started in April of 2020. And so, even though I served as the PI based at UCSF, And Peter was also an integral part based in the UK. He's the man with the tall glasses. We weren't actually able to participate in the project until 2 years after it started. But I think the really great thing about this was that our local collaborators, our Zimbabwean colleagues, really served as the face of the project throughout. I also just wanted to point out this funding statement from one of the papers that we generated, because it basically kind of describes about how our partnership really kind of evolved over time. So initially, the grant that we got from the Gates Foundation was given to UCSF, and I served as the PI. But then when we had follow-on funding from the Gates Foundation, it actually went to my colleague, Precious, the woman on my right. So she served as the PI, and the money was given to her local Zimbabwean company. And then she, contracted to both Peter and me for our contributions. So the last thing I just wanted to point out here is just this logo here of the nonprofit that we have established in South Africa. Note that there's Ubuntu in the name of the organization too. But I think this is really kind of coming out of the desire for any kind of follow-on funding that we got to go to an entity based in the global South. But that hasn't come with like a lot of work and headaches. I think we kind of underestimated the amount of time and resources that were involved in setting up a nonprofit based in South Africa. We've spent like an inordinate amount of time on governance and policies and resources to pay for an accountant to make sure that we can maintain our tax-free status. And Desiree, I would love to talk to you more just about how you've been able to kind of maintain your Kenyan nonprofit for so long. And then this is the last slide that I wanted to share with you. And this actually just comes from my perspective more as a funder based at CIGH. So we give out annual seed grants every year. And I've decided that I really wanted to incorporate like equitable partnerships component into the scoring criteria. So this is a figure that comes from a paper that's now on our website. It's called Striving Towards True Equity in Global Health, a checklist for bilateral research partnerships. And basically, what I'm wanting all of the reviewers to look for in the proposals that get submitted are, are they incorporating recommendations at every stage? So in the design stage, are they doing things like ensuring funding for both HIC and LMIC team members? And the implementation phase, are they trying to utilize local capacity where it exists? And then in the analysis and dissemination phase, are they allowing for valid and equitable shared first and senior authorship? So I'm happy to talk more, but I'm going to pass it off now to Caroline.
Thank you so much. Hi, I'm Caroline Ferguson Irlanda. I'm a research associate in the School of Sustainability, so I would not call myself a global health researcher, but I can see that a lot of the challenges and also the pathways forward are shared, and so I'm so grateful to Desiree and the team for inviting me to speak. Yeah, perfect timing. So most of my work is in Palau, which is an island nation in the Western Pacific. I started this work 8 years ago when I was doing my PhD in partnership with an organization called Abil Society. And I don't want to talk too much about all of the work that we do, in part because it's mostly not global health work. But I will say that the photos that I have on this slide are from the real heart of our work today, which is a course that we teach annually. In fact, we're kicking off this year's cohort, the 5th cohort this weekend, Decolonizing Environmental Social Science Research. And in this course, we take 5 to 10 Palauan high school students, and we teach them how to conduct interviews according to rigorous social science methods. But my colleague, Anne, who's Palauan, teaches the Palauan protocols, the appropriate ways of engaging with elders. She teaches the Palauan values and epistemologies that really motivate the students' questions and interactions with the elders that they interview on topics ranging from traditional fisheries practices to managing a taro patch to the oral histories of the island. To last year, the students studied militarization. And in fact, it was militarization that came to the island that really sparked our next kind of phase of this work, which is thinking about networks. So we have this very robust partnership in Palau. We have this very well-established capacity building initiative. But Palau is an island of 17,000 people. And as we've already acknowledged today, like the problems of climate change and biodiversity collapse are just these massive scale problems. And so militarization is one of these global challenges, and particularly in the Pacific Islands right now. It's not just Palau, but it's all across the Pacific that the US military is really rapidly developing and destroying forests and damaging people's livelihoods along the way. So if you go to the next slide, this really got me and our students and my partner Anne thinking about how do we scale this really deep community engaged work, which relies on generational ties. You know, like you can't fast track generational ties, nor can you really have those kinds of ties in many different communities. And so we've been thinking a lot about networks. And in Micronesia, in Palau, there are these archipelagic relationships. So there's a scale of relationships where something is happening in Palau, and there can be a shared network of understanding across the rest of Micronesia. And so we've been asking, can research networks advance justice, right? In our case, environmental justice, but also global health could be the word there. How does each project contribute to the whole? So how are we making sure that we are not replicating effort, but we are reproducing when and where it makes sense? How can we learn from each other? Because these problems are so interconnected, the problems of climate change and poverty, et cetera, are interconnected. Who do we mobilize for which parts of the work? So what is my role as an academic? How do we mobilize other academics? How do we mobilize other networks of youth activists? And then how do we make research work for the work? So what is the role of research, the process of research itself? How can research be a tool for decolonization and for empowerment? So on the next slide, I had the honor and privilege to postdoc with Joshua Stoll at the University of Maine. He's the one photographed here with a lobster. And Josh is an amazing person, not only because he's a great academic and a great writer, but he's a network builder. He founded the local Catch Network, I want to say 10 years ago. And this is a network in the US of seafood practitioners. So not researchers, but fishermen, aquaculture practitioners, processors, people who work in the seafood industry. And we got to thinking that what an amazing opportunity this is to look at how the national, even international problems of capitalism, of unregulated fisheries, or of privatized oceans are impacting different communities differently. And rather than going in and parachuting into North Carolina and Georgia and Maine and California and, you know, collecting 3,000 survey responses, we instead called upon our network of seafood practitioners, some of whom have formal research training and some of whom don't. I photographed just a few of them on the right here. There are others. But we asked everyone to come together to co-develop some shared research questions and using shared theoretical frameworks, but with methods that are particular to their context and particular to their communities. So these are people who all live and practice in the communities where they're doing their research. And this is a method that I'm really excited about for thinking about how do we scale this deep, deep work. I can't be everywhere at once, nor should I be. But if I know Nico and Fei and Josh and Anne, how can we work together to have more impactful research that doesn't just look at here's how commodification is impacting my fishery and here's how it's impacting my fishery, but what solutions and pathways to change can we actually co-develop together at scale? So that's what I'm thinking about lately. Thank you.
Thanks so much, Shannon. Thank you. And now Camille.
Can you hear me?
Yes, perfectly.
Wonderful. Thank you. So thank you so much for inviting me to this panel. And I have to say how just incredible it is to just be here with so many experts in global health equity. And I know, although I can't see everyone in the room, I certainly appreciate just all of the work that you all do. And so a bit about myself. So I'm Camille Jimenez, Global Health Equity research lead at Pfizer. I also lead Pfizer's Institute of Translational Equitable Medicine, epidemiologist by training, and also have been at Pfizer for just about 5 years now. And prior to joining Pfizer, I've worked in quite a different few positions in the public sector. So I've worked in academia, I've worked at a local Department of Health in the United States in New York, and then I've also worked at the clinical side, recruiting for clinical trials. So next slide, please. So, I think for me, it's super important. I can tell you about all of my academic accomplishments, and the accomplishments that I've done, within Pfizer. But when I think about partnerships, I think about, how we can connect on our values and really what are our shared values. So I just want to tell you a bit about who I am from that respect. So my journey in health equity, and I say health equity because when I studied, I really focused on U.S. health disparities. It really started from just the simple question of recognizing the power dynamics that exist within the U.S. healthcare system and within research. And I always was just interested in how we can move beyond just counting, right? How do we, instead of just characterizing the burden of disease, how can we really shift those power dynamics to enact change and develop impactful solutions? And so you might not expect to hear that from an epidemiologist, but it is so. And so I think that there's a tremendous amount of complexity when we think about health equity. And then, when we think about solving, we have to be innovative. And I believe that real change really starts with building trust. It starts with relational equity and shared power amongst all partners. And so, I'm here representing industry, Pfizer, but you'll hear more about the types of partnerships that I've developed from this side where I sit. It's really all about, how can we come together, like I said, to co-design, co-create, and find that common ground to change and see the world in a better place, or leave the world in a better place than we started. And so, think a bit about Pfizer also. You can see by my title, I have equity in multiple ways. And, Pfizer is one of our core values is equity. And so while we are a medicines development company, we recognize the importance of partnering with diverse stakeholders to co-create solutions, not just in the clinical setting, but also at the bench. So early clinical development, clinical, trials, and then, of course, in the clinic. And so for me, my approach to equitable partnerships is shaped by my professional experience, but also my personal perspective. And I firmly believe that, we can develop strategies and develop programs that are inclusive, but we need to think about transformation. And I want you all to know that industry can really be a powerful partner in this world and in this work. And I hope that by the end of this, talk, you'll see how. Next slide, please. So I'll share some of these 3 examples here that Pfizer plays a key role as an industry collaborator. And first and foremost, our collaboration and partnership with Stanford to launch this Stanford African Scholars in Global Health program. I won't go into too much detail because I'm sure you all are very familiar with it. But this is a program that really bridges global exchange with fostering that bidirectional learning and health equity between African physicians and African medical institutions with Stanford faculty. And we are just incredibly proud of this program at Pfizer and our role in championing this because we recognize that building capacity and supporting these innovative models is how we advance global health equity. Second here, you'll see this partnership with the African Caribbean Cancer Consortium. This is actually a prospective research study that brings together 17 sites across the US, Caribbean, and Africa to study cancer in populations of African ancestry and then in the continent in sub-Saharan Africa. And Pfizer supports this work by bringing our research expertise to the table, supporting through resources, and also our commitment to understanding genetic and non-genetic drivers of cancer, often which are referred to as social determinants of health. And so, this also is a partnership that very much is built on mutual respect and understanding the landscape of disparities, global disparities, but also this project came to be by co-designing with local institutions that are part of this AC3 collaborative. And I think this is another example that just shows how industry and academia and communities can really work together, even in the research space. And then finally, this program with partnership with Precision Medicine for Aggressive Breast Cancer is a partnership with a local organization in Ghana that focuses on translational science. And this collaborative spans about 8 sub-Saharan African countries, and our collaboration with PMABC has really evolved over the years. Most recently, we've focused on training and building research infrastructure as it relates to a study that is sequencing cancer tumors. And so Pfizer also has partnered in various ways. Another way we've done this is held some joint sessions at the request of the local teams to share our own internal knowledge on data management, on grant writing, on scientific communications, with the goal of upskilling clinician researchers on topics that they actually identified as most valuable for their career development. And so, my personal journey and why does this matter to me is because equity isn't just a concept, right? We know that this is really an urgent call to action. And I firmly believe in this redistribution of power across the spectrum of medicine's development, whether it's research, partnerships, and capacity building. And I feel so fortunate to be in this role in industry because, as I said, I was on the public side before, but bringing, this lens and understanding of structural inequities of global health and the role of colonialism, I can really advocate for this work on this side, right? And so, Pfizer is invested in people, and it is invested in institutions for the long term. And so we really are not just chasing these short-term wins. And we really recognize that this is about shifting powers. So thank you so much. And like I said, I just want to leave you all. I know we'll talk about this more, but I think that the future of these global health partnerships and equitable partnerships really depends on bold, creative thinkers such as yourself. So I'm super excited to go into this rich discussion next. So thank you all.
Thank you so much.
Thank you so much. So can I invite the panelists up, and then Kelsey's gonna come put their faces up. That's perfect. Thank you. All right, well, thank you all for those incredible brief interludes into your, and then Camille, can you put your video on when you get a moment? Thank you. Thank you all for that. That was great. That was a great beginning. So I always want to start with what goes well, right? Let's start with what's gone well in your lives. Can you name some partnerships that have really worked well? And I guess the generalizable characteristics of those partnerships that you would hope would apply to other partnerships. And I'm going to start with you.
Thanks, yeah, I think for me, the specific partnerships that I'll give as an example, obviously starting off with the Kevin Wellcome Transmission Program, the background of that is Oxford, the SASH program, and also the University of Nottingham in UK, and the generalizable lessons, so if I could put it that way, which I found very useful in my career development. First of all, picking up an Americanism, first time in the US, that we learned in the last 3 weeks. It's very, very useful to get into the game that play of your own. So you have when you discuss a partnerships with people, you don't have your own play. You tend to get sucked into other people's plays, and you only realize later on that you are not having developing yourself in one way. That is a function of having mentors, and I found it very useful having a mentor, local mentor who has international experience, and also having an international mentor who has local experience. That mix has been very useful in sort of like charting the path and making the most of available opportunities. The second bit is using an African expression is having a home. And by this means having a home institution. When you come to the table with a home institution, ask you where you come from, and you say, this is my institution, back and forth, and this is where I'm anchored. I think that really helps in sort of giving you a card to play one, and also giving you a firm foundation in any discussions that you're going to have in terms of research, training, and any other form of collaboration. Linked to that, my third point is having governance structures. So as developed in my career as a physician and also as a researcher, things that you're not aware of and might not be very clear about when you're starting off. So having an institution that has a clear governance structure that protects both sides of any or multiple sides in any partnership that you're going to engage in is very useful, because it gives you a roadmap that if I'm going to engage in this kind of partnership, these are the things to look out for. These are the things to for each that are each party is responsible for, and most importantly, as a young scientist or a young physician starting out from where I come from, one of the things you really don't want to become is being a data collector in any partnership. And so you want to collect data that you have had a chance to give intellectual input into, and answer questions that are relevant to the population, and also hopefully builds your career as an individual and also the institution that you work with. And finally, just to add, the last bit is I've also learned that what really helps is when I have my objectives and my institutional objectives, I don't necessarily have to meet all objectives in a single partnership. So it makes sense to have the big picture in mind, but then you can also always build in small bits of that big picture in different partnerships and collaborations. Thank you.
Thank you. I'm going to start with one that you just mentioned, that is the clarity. I think in both me being a student here in the US and me being a researcher in the Amazon, it has been very important to maintain these long-term relationships, to be clear on what I want to do as a researcher, what I need, what they need also as the local communities, let's say, and also what I can do, what I can really do. You know, like there's things that I cannot really do when I'm doing research. So in general, this clarity has allowed us to also share, for example, ways on how I like to work. Let's say here in the US as a student, how I like to work. And then in my PhD experience, that was also kind of how my PI respected how I like to work in Colombia, because she doesn't work in Colombia, so that was new for her too. So this respect, this clarity was very helpful to build this long relationship. Another thing was having a long relationship. That's fundamental. Right now, well, I have a long relationship with the people that I have been working always. And right now I can actually think about more things. They are also feel like more, I think they feel more trust for me. So they ask me things that they also want. And that's how we start building like more interesting research, because everyone feels free to just express what they need and what they want about their research. And also I would say this idea of the needs are of course mutual. Like I need something about, let's say, my research because I need to have a salary, but also I have a curiosity. But also I would say mostly, how can I hear the needs of research? How can I use that money to really kind of use that money to research that is interesting for the people where I am, and also to help them develop their own careers. There's biologists there's people that wants to build their own careers, and what do they need? Do they need training? Do they need, all of these things? So I would say money as being very important in that sense. And I think that's, yeah. I could think of more things.
So since we're here in academia, we can like move to some of the barriers now, because I know we want to have a robust discussion about barriers so we can get to the reimagining and redreaming of the better world with more equitable partnership. But so from that academic standpoint, can some of you wonderful panelists talk to me a little bit about the barriers that you face in academia when it comes, because you may come as a person who's very intent on equity, right? And just making it all happen, but then you're stuck in these, imperfect structures. So what's some of that?
Sure, yeah, I'm happy to speak about this. I have like a number of points that I wanted to share. First of all, when I shared the photo of that workshop, we were trying to share draft personas with the various stakeholders in the room. And ideally, it was about, kind of validating the data and making sure that it was aligned with, what the interview participants had shared with us. But, if I had had more time, I really would have wanted to employ more participatory sort of methods to ensure that the interview participants are actually able to participate in the analysis of the data as well. And so there's like a methodology where you can actually just share the interview transcripts with the interview participants and ask them to code the data with you, so that way you're really broadening the perspectives of how the data is being interpreted. The other thing that I also think is really challenging, especially being in academia, is there's this pressure, especially if you're in a faculty position, it's like a publish or sort of perish sort of environment. And so I think when you're evaluated, the evaluators want to look at, are you the first author, or are you the last author? And so, if you're kind of not either of those, then that doesn't always reflect well, I think, on how you are being assessed. And the other thing that I wanted to share, just with that follow-on funding that we got from the Gates Foundation, where it went to my Zimbabwean partner as the prime, it was also an opportunity for my local partner in Zimbabwe, Joseph, to actually be the first author on one of the 3 papers that we produced. And so I think that goes, a little bit to help kind of address the situation that oftentimes authors who are based in LMICs are stuck in the middle. In fact, there's even an article, I think, in BMJ Global Health called Stuck in the Middle, and it's basically the systematic review of collaborative African research, where it's showing that like maybe only 50% of first authors actually originate from the country where the research is being done. And then when top US universities are involved in the collaboration, that number dwindles to 23%. So I think those are just some of the barriers that I wanted to share.
And Caroline, can you add your perspective too?
Yes, I mean, so much of what you've just shared, Amanda, is what I had written in my notes. The timeline of partnerships is very long, and the speed of community-based work is so much slower. Grant timelines don't often align well with the timelines of community-based work, and academic timelines even less so. This push to publish or perish is harmful, not only because it's relying on this speed and this currency that is not necessarily tangible to community partners who don't have an interest in research, but it also deprioritizes other kinds of outcomes and outputs. There's also not, I mean, I think this is a little bit different, luckily, in public health, but in sustainability, at least, there's really no valuation of community partnership in hiring or tenure promotion. There's no valuing of like the quality of community partnership, right? If we see, as Amanda mentioned, that someone else is the first author, I think that requires another question, right? Why is that person the first author? How are these authorship decisions made? That in some cases, that is actually a marker of like better research practices, that this person up for promotion is not the first author on very many publications, or the last. And I think I would also add the devaluing of local and indigenous knowledges broadly within academia. I think we've seen an increase in interest, and I know even Stanford right now has a position open for a traditional ecological knowledge professor, but this is new, and I would say it's somewhat siloed. And so, at least working as I do in indigenous communities in Palau, a lot of times the ways that their knowledge has been produced is not valued on the same level as the scientific process. And so many resources are spent going and validating this knowledge, just ultimately proving like, yep, it was right. And then for what purpose? Who is that research benefiting? So I think, yeah, there are so many things that we could say, but I agree with Amanda that these are some of the ones that come up again and again.
Well, do you have anything else you want to add to that?
Yeah, thanks, Desiree. So I can add I think one challenge which is based on my personal experience. I think people do have different career trajectories in terms of in different countries. So for my personal as a physician, as our training is typically starts off in undergraduate, then you your residency, equivalent to residency training. And if you're interested in research, then you start your research training after you've done your specialty training, which is very different from what I've observed here. Like people are generally embedded into. If you're interested in research, you start being embedded in research right from the undergraduate level. And by the time you're doing your residency, the pathway is to take a time off from research and come back and do those sort of things. So what that leads to is that you end up when you're now working with people globally, what would typically be called an early career researcher, especially if you're a physician back home, it would typically be a 35 to 40-year-old compared to maybe a 24, 22-year-old. And it does tend to make it look like, where have you been? Is somebody who's not aware of what's happening there? And it does lock out people from some opportunities which are based on assumptions about career trajectory. So that's understanding of different pathways and how those pathways could fit in, and if you have people where they're very different, perhaps being lumped in the same in some opportunities. Yeah, I think for this one of the values of this. Thank you.
Yeah, again, I'm just going to talk about language because there's a lot of dominance of English in academia, and at least in Colombia, that has a lot of consequences. So let's say that I go to the field and I know a lot of local biologists, but then they don't speak English. They don't know how to write in English, so they cannot really publish in English, which in a point is okay because we could read the papers in Spanish, and maybe that's even better for the local population to read the papers that are being produced. But actually, to advance in their careers, they need to publish in English. That's kind of the global requirement now, because we are always comparing to the US or to Europe how to be like, all of these metrics of success. So the point here is that at the end, all of these publications have this problem of communicating in different languages. That means, of course, communicating not only with the local communities, but also students that want to be doctors, want to be biologists, and cannot scale in this career. And also even communication itself, like scientific writing is very methodic, is very strict, and we cannot communicate every knowledge in that way. Communicating, for example, ecological knowledge from an indigenous community. Probably some of them can make it like writing in this way, but some of them not, it's not the same. So all of this way on how we communicate science at the end is not communicating knowledge. And I think that's one of the big barriers.
Thanks for that. Camille, let's jump to you. You talked a lot about equity and trying to ensure equity at Pfizer in the partnerships. Can you talk a little bit more about that, and also take note and tell us about how you actually get funding leadership to really buy into the idea of equitable partnership?
Yeah, thank you. It's a great question. I'll start with the latter part. How do you get leadership to really buy into this idea of funding partnership? And honestly, I've learned while I've been there that it's about speaking the language of industry, right? It's about speaking the language of science and sustainability and scalability. I think that within the organization, many leaders previously may have felt that partnerships feel very abstract until you show them how it really improves clinical care, how it improves data quality, and even if you're submitting to regulators with data, how it increases regulatory confidence, right? Because you have diverse data, data that's generalizable, representative, and it's innovative. And so one of the things that I had worked on initially was developing an equity framework for the Institute of Translational Equitable Medicine. And I made the case, with our former chief medical officer, that inclusive research wasn't just a nice to have. It wasn't charity. It wasn't philanthropic. It was really scientifically essential, right? And we see, and you've all mentioned it, studies that really integrate the community, the patient's perspective. You generate that richer local contextual truth. And again, it really makes that data more generalizable. And I think that that's the kind of data that our stakeholders, the kind of evidence that stakeholders, such as patients, regulators, payers, industry also, and clinicians believe in. So really making that case of this is not just the right thing to do, it's good for business and it's good for patients. And so so I think really once leadership saw that equity really drives that credible science, they started to see the conversation was really shifted from like, well, why do we have to do that, to like, how fast can we do this, right? Can we do more of this? And so that really was really exciting to see.
Sure, yeah, just to kind of add to what Camille said, I think in addition to like just better research quality and incorporating diverse viewpoints, there's also just the kind of ethical argument that this is about the principles of fairness and respect and social justice, and that you can really foster that there's this bi-directional knowledge transfer, that it's not just one way, and so there are a lot of benefits that can come in our direction as well. And then just that this too, it's really helping to foster these trusts as well as long-term collaborations. As Camille said, I think it's also just about the bottom line. It's cost effective when you are utilizing and strengthening local expertise. And lastly, I think just the argument too that I think it also helps to address the brain drain, which is like a huge problem, especially in the African continent.
Okay, thank you. Okay, so we only have about 10 minutes left, and I definitely want to open it up to questions. I'm gonna ask you guys each just one final question, and then all of you hopefully will come up and ask questions. So we're talking a lot about how we really try and approach equity and partnership, but all of these systems that are sort of against us. And I guess if you had a magic wand and there is a system that you could change, let's talk about it. I mean, there's training and there's funding and there's so many systems, right, that we're part of. But what structures? What are the structures that you think most need to change to move us all towards a world where equitable partnership is just common day? And I'll start with these ones, and then we're going to go to you two up there, and then we're going to open it up to our wonderful audience here.
Okay, yeah, that's a big one. So, if I was to change anything, obviously, I'm biased being working in a university. I think one of the things which we need to take responsibility for ourselves, where we come from, is the perception of what knowledge is and the role it plays in society. The reason I'm saying this is in our typical university or higher education institutes, it's modeled around teaching, and not so much the generation, the curation, and collection of knowledge, which is different from what you see perhaps in this context, where you clearly also read the sham courses a video. This is actually for good, called Professor Moriarty, when you have this web. And so imagine you're sitting in Stanford, within Stanford, this web which is reaching out to different parts of the world, but all leading back to Stanford. And there's people who are actually sitting and curating all that knowledge that is being generated across and storing that knowledge, and teaching is just part one bit of dissemination. So having that perception that our research and especially our academic institutions are supposed to be first and foremost repositories of knowledge, and then second after that, you teach and train people to produce the material, the knowledge you generated. I think for me that's the big deal.
Yeah, I just have to say, I have a friend who started an organization called Heart AI, which is using AI to do exactly what you're talking about and collect all of this indigenous knowledge and all these ways of knowing and create it and then make it available for everyone to use. It's amazing.
So I also think that there needs to be some sort of change to the incentive structure for in academia, especially for evaluating faculty. So maybe something a little bit more comprehensive around not just looking at, are you the first or last author, or are you the PI on, you know, X number of grants, but how are you including equity in your work, as well as how are you impacting the community? And so I think someone had mentioned, like, you know, wouldn't it be great if what evaluators wanted to see was that you are like the middle author on things, or you were subcontracted by an LMIC investigator to do the work. And so just, I think that it's a very big change that would need to happen, but I think it would then contribute to some of these power imbalances.
Yeah, I think we are thinking about kind of the same things, but I was thinking to just eliminate ideas of success at the end. I think that has to do with both. I don't know if I think about these ideas because at the end, when I, for example, me as an academic here and I go to Colombia and I have, then I have a PhD degree here in the US. So everyone's like, "Whoa, you must know a lot." It's like, no, I just know the same. I just went to the US. I know things about migration to the US. That's something that I know. But the point is that it's very difficult for me to say, you know what, you have also like so much knowledge. I don't even know how to express that. Because it's more like about the ideas of success and how everything is determined from another way to see the world, and you are not enough. And so at the end, that's also translated a little bit on, like, first of all, how we incorporate other knowledge as valuable, how we don't think about being an academic only to if you are a first author, and for me also about love, because you can love someone that does whatever they are good on. So that would be very cool to have.
Yeah, Camille, you want to answer that one for us?
Yeah, I think one of the areas that we've been focused on with our global collaborations is tackling data governance. And so I mentioned that we've been collecting, data prospectively on African ancestry patients. And when we started these collaborations, we actually went through our boilerplate, contracts, and really made sure that our partners had access to biospecimens and data, all of the institutions that were part of it. So not just the sponsor. And I think that is such a simple but profound structural shift, and it really redistributes that control and power and fosters trust. And so it certainly, contracting is never easy, but I think, when we shared with legal the importance of this and how this was the equitable way of approaching these collaborations, they really understood it. So just was really, really proud to be, a Pfizer colleague as a result of that. So yeah, that's just one of the ways.
Thank you. And now, Caroline, your turn. And if your cat has a comment, your cat can also comment now.
Equitable. No, I mean, everything that's been said, I totally agree with, and everything has nuance. I would just add the structure of funding and philanthropy is inherently so inequitable, right? The fact that it's wealthy governments and wealthy individuals from wealthy countries that really are funding almost everything limits the sort of transformative potential of our research, because there are certain things they're just not willing to fund. And certainly we've seen that with this administration. People have had grants pulled. And so I don't have a simple answer to that, but I think it's so important that as we are working within the systems we exist, we're also reimagining a radically different and better system for more equitable partnerships.
Thank you so much. Does anyone in the audience have a question? Yeah, oh yeah, good, we have lots here.
Hi, thank you for the talk. I'm Madeline. I'm a researcher related to health economics, and one thing I'm curious about is that so partnerships are hard to start, but I think they're even harder to grow and maintain and sustain over a long period of time. So what do you think are your thoughts and recommendations for how you not only start them, but also maintain them over long periods of time?
Thank you.
Sure. I mean, I think like, as I think back on my long-term partnerships, I guess it's been like 8 or 9 years now, and how our relationships and roles have evolved. It's really about like being flexible. I think, so much of working in global health is about flexibility and not being stuck in some rigid roles, but also coming at it with lots of humility too, and realizing that you have roles to play, but like all your partners to have an equally, if not more important role to play as well.
I don't know, online, Caroline or Camille, I don't know if anybody wanted to comment on that one.
Yeah, I'm happy to add to that. I think that partnerships I think that was Amanda, but can evolve and perhaps I always say that industry really likes to pilot things and support pilots, right? With the intent that it's scaled, right? And so how can, if we don't continue to fund it, because that perhaps is not one of the models that exists right now, how can we partner to find other sources of funding, right? And so I think partnership can look and feel different, but that partnership remains if you know that, we started together and we want to continue to see this succeed, even if it's not with us, right? So I think that is a way that partnership can be sustained beyond funding.
Thank you. And I'd say that's happening a lot right now in global health, as many of us have lost a lot of funding to really fund these partnerships. But I'll go back to just the joy of human connection. I mean, I've been working in Kenya for 20 years, and these are truly some of my very best friends now. We've grown up together, we've changed roles, we've learned about each other, our families. I mean, it's just what we've grown up together. And so, the funding does come and go, it ends, but the human connection can remain. And I think finding that beauty and bringing your whole self to the work so someone can really get to know you, and then finding those people in the world that want to keep working together is really powerful for maintenance. There was another question over here. Oh, here.
Thank you. And it was more of a comment and maybe some reflections from the panel. Thank you for the excellent discussions. I'm in global oncology and really involved in cancer research across Africa. And part of the challenges that we're seeing in academia, as well as Eloquently alluded to, but one of the things that we're seeing is in terms of research is kind of something you do in your spare time. And so the university is not the primary generator of new knowledge. And when we have, looking at global oncology, we're seeing that our output is only like 8% of the total sort of African output and less than 1%. But when you're coming down to a granular level, what we find is that universities, we almost have a new sort of quote unquote scramble for Africa. So Kenya is divided into regions where one university does this, one university does that. My question and reflection is, in a world, how do we have an opportunity for, I would say, combined advocacy? Because again, to get research, you don't have protected time. You still have the tension of incredible workload. And somehow when it comes to promotion, you need to have cleared the queue and suddenly you have gotten, peer reviewed and stuff. So really reflecting on what is the opportunities around global advocacy where we can, one, hold our universities accountable, but also knowing or keeping in mind that countries that are actually having more output in the African continent around the universities are actually countries that are self-funding or actually generating questions that are in line with the priorities. So really asking the question to the panel around what are some of the opportunities you see for both this global advocacy at an institutional level and at a policy level. Thank you. Who wants to take that on? Anyone? No? No one wants to take that? I was thinking Caroline and all about that, but no? No, okay.
I'm not sure maybe help with the media. We are saying the same boat.
I know.
Well, I think for me, I think what just a personal opinion. I think one of the things which is very useful, which we found very useful, is to get that kind of approach that we are talking about is when you involve the policy makers, especially the Ministry of Health and Ministry of Education, because whenever you pitch things which are policy aligned, then it gives you lots more strength when rather than when they look like they're personal interests. The reason I'm saying so, I'll give an example of, for instance, the work we've done in Human and Health in Kenyan hospitals. So it started off as a research, and research was considered something that people do, and they really, I think, believe in. But because by embedding that research within the practice and involving the Ministry of Health in the work we do, and having the university as a partner within that research work, so we have a three-way sustainability platform, because we generate knowledge that is taught at the university level, and also taught at the hospital level and practice at the hospital, and it also serves the Ministry of Health's purpose, that this is a work that aligns with our goals as a ministry, so that the research does not look, for lack of a better word, it doesn't sit on an ivory tower, and does not align, because I think that's one of the biggest issues we have typically when you something for the Ministry of Health, that how does the science help my life? But when we start talking about figures, facts, the eyes be out, and we tell them, this is how you start off, but this is your problem, and this is how my work fits in your problem. Then you can see a light bulb moment for them. I'm not sure we have information. Yeah.
I mean, that gets back to what Val was saying too about communicating, and I'll let you speak. And then Caroline, I know you were saying that the audio wasn't good. We're just talking about sort of like local advocacy and how do you build those like relationships, because what you're talking about in Kenya, it's a power dynamic, right? Like this university does this, they have all the power, and then how do we elevate these other ways of thinking, other perspectives, other knowledge in order to solve the problems, right? And so I was just thinking about how you got Micronesia together and how you're trying to build those networks, right? As a powerful, to really build power and voice in generally marginalized voices, right? So anyway, we'll let Val speak, and then maybe if you have a comment.
Yeah, no, super quick, because I don't work exactly in the medicine world. I don't know how it works, but I can give my perspective. Also in Colombia, there's universities that are more prestigious than others. And that means also, for example, in the Amazon, there's a university, but it's not as prestigious as if you come from the city. And I would say, for me, it has been two things. One thing is to kind of see what legislation comes about that, but also is to write our own legislation in a way that, I don't know, for me was when I thought about a paper that I published about doing fieldwork in the Amazon. I put what I was imagining could be a better way to do it. And then I presented, and then it became like kind of a word for like, oh, this is the way that maybe we can do it. And it changed a little bit, but at least changed how I approach research around me. And I don't know, I'm just thinking like maybe we can just imagine our own legislations and start to publish that and see how it reacts and become a kind of an exercise of discussions. Yeah.
So Caroline, did you want to, and then
Yes,
you should
thank
talk
you
about the paper that you're working on too.
I'm sorry I couldn't understand the audience question very well at first, but since hearing you now, I think one real strength in Palau in terms of integrating local knowledge into policy and practice in the education system is that it is a sovereign nation. And so in order to implement the findings of our research, decolonization is actually like essential at the country level where we work. And that's certainly not true all over the world, right? There are many colonies remaining today. And so, yeah, I'll start there.
Thank you. And then I think we're probably gonna have to end, but Ola, you have like one quick question? You have a quick question? It got answered. Okay. All right. Well, I think we have to end because other people are coming in this room. I will help me thank our panelists for this amazing hour and a half. Again, if you're interested in this, there's going to be a course talk. There's a new web page about it. There's a lot of resources on that web page. The discussions will continue, and hopefully all of us will bring ourselves more equitably to our partnership and just start these discussions, if nothing else. Thank you for joining us today.